Today I'll be treating tennis elbow lateral epicondylitis with the Endolaser 120 using a 900 nanometer wavelength probe. This is a single probe, so it's 1 centimeter squared off the head of the probe. The literature in and around the lateral epicondyle seems to suggest the 900 probe is the better one to use. It is an area that's mainly tendon onto bone, so that would fit in really with the background literature surrounding laser. It's pretty much the same for the medial epicondyle, if I'm honest. The two aren't very different, just different sets of muscles that do two different actions. So we're going to go into the clinical protocols first of all. If you look here, we'll scroll down and you'll see lateral epicondylitis will come up, tennis elbow. Looking down the settings, you'll see that we've got 2 points. We're going to be giving 4 joules per point. That's pretty much in line with the Walt guidelines. Joules per session, 8 joules. It's going to take 1 minute 20 seconds, so that's half of that per point. So it's 40 seconds per point, in other words, and it's going at 100 milliwatts. So we're going to press OK, and the laser's ready. I'm going to take the laser and do the first part of the treatment, and I'll see you back from the patient's perspective. Seen from the patient's perspective, we'll bring the laser onto the tender area on the lateral epicondyle. This treatment is done over 2 points, so you'll see the first point and then the laser will pause, and then we'll move the treatment head and do the second point, giving a total of 4 joules per point. If the area is bigger, you can give treatment across more points. That would just increase the total joules of the treatment. That's point 1. Then I'll move on to point 2. It's not unusual to come down onto a point like so, just picking up the muscle and the tendon and then coming down onto the point. I'm not going to do that today. I'm just going to come across. This will be the second part of the treatment, the second point. If the area is quite large, you might need to do 3, 4, 5, 6 points. There would of course come a point where using a cluster probe would be more efficient if you had access to a 900 cluster probe. Back at the machine now, you'll see once we start the treatment, the timer starts to count down. You'll see here the joules counting up. We'll get 4 joules in the first 40 seconds, and then we'll readjust, move the treatment head. We don't want to overdose, although the literature just suggests that the effect of laser may be pain relief rather than anything else, and so overdosing may not be, again, the worst idea. We'll move the laser head and do the second point. It's not unusual to do 3 points, as I said earlier, and maybe even 4 or more points. That's the first part of the treatment finished. I'll just move the head and then we'll give the second part of the treatment. Not unusual to give 4 points, more points. There would of course come a stage where after 4 points, a cluster head, if you had access to a 900 cluster head, may be more efficient. Most people don't have access to a cluster head of 900. Of course, beyond 4 points, a cluster head would become more efficient. All that would do is cut down your amount of time. As you can probably see, the time isn't that long for doing this treatment anyway, over 2 points. So even at 4 points, 6 points, you're only doubling the time. So with this particular machine, 4 points would be 2 minutes 40 seconds. 6 points would be 4 minutes. So you in essence just going up 1 minute and 20 seconds for every 2 points that you do, or 40 seconds per point, depending on your perspective. They're not that lengthy a treatment overall. Treatment onto the lateral epicondyle for pain relief has been shown to be good, but it probably requires some other rehabilitation at the same time, exercises being the preferred method.